The flu season is turning into a crisis for families across the country, with more children facing life-threatening complications than ever before. This alarming trend is directly linked to a sharp drop in flu vaccination rates, according to a recent report from the Centers for Disease Control and Prevention, CDC. Christine Ware's voice quivers with worry as she describes the uncertainty of the upcoming flu season. Anxieties are high, she says. We're trying to navigate what life should look like without being in a bubble. Her 4-year-old son, Beckett, is still recovering from a severe flu infection he contracted in January. Within a week of becoming ill, he became lethargic, unable to move his head or arms, and lost the ability to eat or speak. Ware, a mother from River Forest, Illinois, knows the danger firsthand. This is the second time Beckett has developed acute necrotizing encephalopathy, ANE, a rare and severe inflammatory brain disease caused by the flu. The first time, he hadn't received his annual flu shot. The second time, he did, but evidence suggests that the vaccine may not always protect against flu-related brain inflammation, especially in children who've already been infected. This year, doctors are reporting an uptick in cases of pediatric ANE and other flu-related encephalopathies. During the 2024-25 flu season, 109 children were diagnosed with influenza-associated encephalopathy, IAE, a condition where the flu virus attacks the nervous system. Of these, 84% had not received the flu shot, according to new CDC data. But here's where it gets controversial. Is the flu shot truly effective for everyone, or does it only matter for those who are already sick? Dr. Creech, a pediatric infectious disease specialist, argues that it's a misnomer to think that only sickly kids get complications from the flu. He emphasizes that the vaccine is a proactive measure to prevent severe outcomes, not just for vulnerable children. ANE is rare, just a handful of cases each year. But this year, doctors are noticing more children with brain inflammation after the flu. Being on the ground, caring for these patients, I was certainly struck that this was an increase, says Dr. Molly Wilson Murphy, a pediatric neurologist and author of the CDC study. We don't know in real numbers if this is an increase, but the pattern is clear. Flu complications are deadly. Of the 109 children diagnosed with IAE, 19% died. Others required intensive care, ventilators, or long-term recovery. Flu is dangerous for children, period, says Dr. Keith Van Haren, a co-author of the study. That is not a mischaracterization. The problem isn't just the severity of the illness, it's the decline in vaccination rates. Last year, fewer than half of children, 49.2%, got their flu shots, down from 62.4% in the 2019-20 season. Experts say this drop is due to a combination of factors: vaccine hesitancy, access to care, and staffing shortages in clinics. A lot of families are experiencing access to care issues, says Dr. Sean O'Leary, an infectious diseases expert. And a lot of practices are struggling with significant staffing issues. Yet, the vaccine remains the best defense against flu-related hospitalizations and deaths. Last year, the flu shot was up to 78% effective in preventing hospitalizations. And for children like Beckett, who are at higher risk, the stakes are even higher. It's easy not to worry about it when it doesn't directly affect your family, says Christine. But vaccination is a simple and easy way to protect my son. So, the question remains, do you think the flu shot is just for those who are already vulnerable, or is it a critical tool for everyone? The answer, according to experts, is clear. Vaccination is the simplest, most effective way to protect children, and it's time we take it seriously.